Hello friends, good morning everybody. I am Dr. Nitin Yogesh and I am working as a consultant neurosurgeon at Max Super Speciality Hospital, Mohali, Chandigarh. I was previously working in PGI Chandigarh as a neurosurgeon. So today I will be talking to you about a very common problem in the society which can affect a person at any age, starting from childhood to the elder population, and that is epilepsy. Epilepsy, as we know it, is a common problem in our society and it is associated with a lot of taboo. All the people, including those of rural and the urban area, have different myths and different versions of the disease. Some are really afraid of them and some of them have a little knowledge about the treatment protocols followed when a patient is having a seizure, as we call it in technical terms. Seizures or fits are one of the manifestations of surgery. In general language we call them fits, but seizures in technical terms, and they are one of the manifestation of a disease syndrome called as epilepsy. So what is epilepsy or a fit? So basically our brain is made up of a lot of electrical cells, in the general term if we can call it, called as neurons. And our brain has an immense amount of electrical activity which, if functions normally, then the person is always behaves like a normal person. But if there's an electrical overexcitability or electrical discharge which is not normal, then it gives rise to fits or seizures. So this abnormal activity manifests in the body like various movements and various discharges and various problems. It may be in form of jerking of movements, it may be in the form of loss of speech, the patient becoming unconscious, or a lot of other manifestations. So this electrical activity of the brain, when it becomes haywire, then it is known as epilepsy. So there are a lot of myths in the society about epilepsy. First of all, that epilepsy permanently damages the brain. Once a patient has a fit or epilepsy, he cannot be treated. There's no treatment, and he will, to the extent that some people think that once he has a fit, the person cannot be cured. Some people think it as an evil omen, or some people have the different versions. So the prevalence of this epilepsy in the society is somewhere around 1 to 2% in the Indian population. There are various sorts of epilepsy which we come across in the OPD, and in fact most of the neurology and the neurosurgery OPD have fits as one of the presentation of the diseases. So what are the ways in which can broadly classify or in fact divide epilepsy? That is, we have generalized two forms of epilepsy. One is a generalized fits or generalized seizures and a partial seizures. So what is generalized seizures? Generalized seizures is one, technically what we call them, when you see seizures. For example, a patient is becoming unconscious, he is throwing fits, clenching of mouth, frothing of mouth, uprolling of eyeballs. This period lasts for around 2 to 3 minutes, and then the fits stop and the patients become unconscious for some period of time. The whole activity is somewhere around 4 to 5 minutes and stops. So that is a generalized seizure. The other thing is partial seizures or focal seizures. Now these can have a lot of variety or different presentations, and usually it is not easy for a layman or a simple doctor to pick it up. This requires a diagnosis by a physician or a specialist neurologist or a neurosurgeon who is used to seeing such sort of patients. And sometimes it cannot be diagnosed because the person is totally normal in between the periods. So we have various types of partial seizures. These partial seizures can occur in the form of simple jerking of one limb, twitching of face, loss of speech, or just a blank look. The patient can have a blank look for a fraction of a second and then the next moment he is normal. So these episodes occur repeatedly a number of times in the whole day, and especially in children these leads to difficulty in concentration at school. So usually the teachers complain that the child is not concentrating, whereas in that patient is having a seizure or the child is having a seizure. So that is very important to diagnose and treat, because then it can have a bearing on the development of the child. Childhood epilepsies are very common, and in fact a lot of number of patients present to us in the OPD where the seizure onset is in the children. So what are these childhood epilepsies? So they can be idiopathic, they can be secondary to some disease in the brain, or they can be a part of any syndrome which a child may have. So proper diagnosis and treatment is very much important, because then it can lead to further developmental problems later in the childhood. Apart from that, there are a lot of syndromes in the child, like developmental disorders, milestone delays and congenital defects, which can also give rise to seizures. However, in our Indian population, most of the seizures or the fits where we see are idiopathic. Now, what do we mean by idiopathic? That is, there is no cause which has been detected. As I told you that having fits is just a part of abnormal electrical activity. So in that way, our brain gets different electrical discharges, and when they misfire, it leads to a seizure. There might not be necessarily an underlying problem in the brain which can always cause a seizure. However, there are a lot of other causes which can give rise to fits. So these can be genetic causes. A simple infection of the brain like meningitis, encephalitis can also give rise to seizures. Infections like tuberculosis, which is very common in our society, in this part of the country and on whole of the India, is very common cause of fits or seizures. Head injury or head trauma from any other cause is also a very important cause of seizures in adults, especially in patients who have a head injury previously. Apart from that, in children, as I told you, prenatal injury during the birth, or some infections while the birth is taking place, or when during the pregnancy period, can also give rise to fits. Developmental disorders are very common in Indian population because of the lack of the hospital access, and also because of the lack of awareness of the mothers about the antenatal checkup. So these all have a bearing on the later development of a children and proponents of recurrence of seizures in the children. Apart from that, coming to the neurosurgical part, like these are some of the medical causes. Now I would like to tell you about some of the surgical causes which also can give rise to fits. In fact, seizures or fits can be one of the first presentation of a patient having some sort of problems in the brain. The most important of them are the brain tumors. Now, brain tumor is basically intracranial space occupying lesion. It is a small sort of lesion in the brain which occupies space, and then it causes a lot of pressure in the brain. So brain tumors have a variety of presentations, but fits or seizures are one of the most common presentations, especially in a few selected cases of tumors. These can manifest as having a partial seizure, that means a simple jerk in the body or a numbness in one part of the hand or finger can be the presentation of few of the brain tumors. A brain is made up of two parts, cortex and subcortical structures. The most of the patients which have fits or epilepsy have a cortical lesions, because these are the areas where the brain is maximally irritated. So a diagnosis of seizure is very important. Apart from that, head injury is also an important cause of brain the seizures. Now what happens in head injury is that any part of the brain can be affected during a head injury or a trauma. So the patient can present with seizures or fits when he comes in the emergency soon after the accident, or he may not develop any seizures during the whole course of the treatment, but later on in life, maybe 3 months, 6 months or 1 year even down the line, patient can have seizures, which is basically due to a damage in the area of the brain which has been damaged by the injury. So these are some of the causes. Apart from that, any surgery of the brain, sometimes we do surgeries for different reasons, can also give rise to seizures, but that comprises of a very less percentage, and that is not a major problem. One of the important presentations in our country is an infection called as a Neurocysticercosis. Almost we see a lot of patients in our OPD who develop Neurocysticercosis, and that is one of the important causes to rule out. So a diagnosis of epilepsy or seizures is very important because it can have a lot of causes associated with it. As I told you, seizures of it is not just a disease, it is a symptom, it is a sign by which the brain tells that there is something wrong which is going on. So we need to detect it and then treat it. Coming to the risk factors, which is a very important question which the patients ask, that what are the risk factors why the patient develops seizures, is that there's no one cause, but there are a lot of number of factors and which can vary from one person to another. For example, lack of sleep is one of the important causes of precipitation of seizures. Then there can be family history of seizures, and those patients are more prone to develop epilepsy or seizures in their lifetime. Apart from a previous head injury, previous any infections, and all these risk factors definitely increase. Apart from that, some people are prone to some surrounding problems like increase in the noise, increase in the flashlights. So these can also precipitate seizures in the patients. So how do we diagnose when a patient comes to us with epilepsy? So there are a lot of tests which are available, but the most important thing is the examination of the patient. A proper neurological examination will give us a clue, a lead that what is the problem with the patient. So that is the most important aspect, and that has to be done by a specialist to detect it. Apart from that, once we have done the examination, we have a lot of other investigations like the CT scan, the MRI with specialist protocols in MRI which can diagnose seizures to a very precise extent. And there are a lot of other investigations like EEG. EEG is basically electroencephalogram. So it tells us about the electrical activity of the brain. However, not all ECGs come abnormal in a patient of epilepsy. That is because when the patient is normal, he is not having a fit, then the electrical activity can be normal. However, it is an important diagnostic step to perform an EEG in a patient of epilepsy because it can give us an information about the background problems. Apart from that, there are a lot of other new investigations like the PET scan, the SPECT scan, which help us in further diagnosis of this problem. So a proper diagnosis if made, we come to the treatment. Now the treatment of epilepsy is not just the treatment of the fits, but also the treatment of the underlying problem which is causing the fit. There are a lot of medications called known as anti-epileptic medication or anti-epileptic drugs, AEDs, which we give the patient to treat. One of the important things which I want to convey is that epilepsy or fits are totally controllable. They have a specific treatment and we can always cure them. So one should not think that once he has epilepsy, it is for life. He will not be cured. So that is a wrong concept. There may be refractory epilepsy, which I will tell you later, but there are conditions which can be treated and the patient can become totally normal. The treatment of epilepsy is started with the anti-epileptic drugs. Normally we put the patients on a single drug, but if he does not respond, we can increase the dose or we can also add the drug. There are a lot of new and very good drugs which are available now, which were not previously in the market. These are usually safe and they do not have a lot of side effects too. They can be taken even lifelong for some few patients once they have such problems. So combined with the newer drugs and a proper diagnosis, the treatment of epilepsy has revolutionized in the past few decades. So the important thing to note down here is that the epilepsy drugs or the AEDs or the anti-epileptic drugs have to be taken regularly at the advice of the doctor. These drugs are based on the weight of the patient and various other factors. So you cannot just take them on as and when basis. It has to be a proper dosing and you don't have to miss the drug, because if you miss the drug, you can have another fit. So that is very important, and that is one of the important reasons of recurrence of the seizures in patients who come to us, because they might have not deliberately but unknowingly they would have missed the drugs and then they would not have taken note of it. So that is an important thing. Apart from that, the medical treatment, we have a surgical treatment of epilepsy. For example, in patients who have a specific lesion like a tumor or some part of the brain is damaged, then we remove the tumor and the epilepsy is cured. We also have epilepsy surgeries in which a part of the brain which is responsible for giving rise to fits is removed and the patient is cured of the tumor of the surgery. Apart from that, these surgeries have to be done after a proper investigation has been done and the cause of seizures or fits has been diagnosed. So that is very important. Apart from that, the epilepsy problem in patients who are pregnant is very important. People think that during pregnancy, epilepsy drugs can be harmful for the fetus or the baby. However, with the advent of latest drugs and with the newer advances in our treatment protocols, the treatment of epilepsy during pregnancy is totally safe, because at that time you have to consider the harmful effects on the baby also. So in conclusion, I would like to say that epilepsy, although a major problem in our society, but it is completely treatable, and there are a lot of number of treatable causes which have to be diagnosed initially. A proper examination by a specialist and a proper compliance by the patient is very important for the total outcome and increase in the outcome or good outcome of the epilepsy patients. Thank you.